There are a lot of options when it comes to your Medicare insurance. You've got Medicare Supplement Plans and Medicare Advantage plans. Where do you turn? Well, I will tell you this much. In 2022, more people will be enrolling in Medicare Plan N than ever before. Stick around to find out why. My name is Russell Noga with Medisupps.com, and along with Diana Firth and Teresa Horazga, these ladies are two of the top producers in the country. You are going to want to talk to them, believe me. We've been helping people for over 13 years with their Medicare insurance, and we'd love to help you as well. So after this video, give us a call. Our phone number is down below. You can also always visit Medisupps.com where I give you free online quotes. There's never any cost for anything we do or any obligation. I'm one of the only people who shows you the rates online. So go ahead and visit or give us a call when this video is done. So perhaps in the past you may have overlooked Medicare Plan N, given that there's some plans with higher coverage. For years it was Medicare Plan F, offered 100% coverage. Well, that's not even available to people new to Medicare now after January 1st of 2020. Then there's Medicare Plan G, which is still available, and it's got great coverage. Believe me, if you've got a Plan G, you've got the best plan out there. There's just one small deductible to pay, and then 100% coverage. So you might be saying, Russell, why would I want to look at Plan N? Well, we are switching more people to Plan N than ever before due to its lower cost than Plan G, as well as lower rate increases each year. Let's start with the premium difference on Plan N versus Plan G. And we're not even getting to Plan F, which is even more expensive. With Plan N, you could have lower premiums up to $25 or $30 less per month than Plan G, which is fantastic. Yes, the coverage is a little different and a little less, but it's still great coverage. Now, Plan N, you still pay the annual Part B deductible before Medicare is going to pay any of your bills. Why? Well, it's a Medicare Part B deductible, which means you have to meet a certain amount. In 2021, that amount is $203. In 2022, I think it's going to be about $208 or $210. Once that amount is paid, Medicare will come in and pay 80% of your medical bills. Plan N will pay 20%, the remaining 20%, just like Plan G does. However, some small differences. If you go back to the doctor during the calendar year on Plan N, you will have up to a $20 copay per doctor's visit. That means it will never be more than $20 per visit. Could be less though, could be no copay. And if you do a telehealth visit, well, there's no copay at all for those. So that is another difference between Plan G and Plan N. So if you go to the doctor quite a bit, say once a month or more, Plan N might not be the best option for you. However, anything less than that, you're probably going to save money on Plan N, and in some cases, some big money. Now, one other thing on Plan N that you're required to pay is if you visit the emergency room and you're not admitted, they will bill you a $50 copay. If you go to an urgent care center, however, there's no copay. So just to keep people out of the emergency room for non-emergency items, there's that $50 copay. In the event you go to the emergency room and you go home, though, that's a good thing, right? They didn't keep you overnight. They felt you were well enough to go home, pay the $50 and be on your way and go get well. One other thing on Plan N, which is very, very rare, is what's called Part B excess charges. This is where the doctor refuses to or declines to accept the assigned rates from Medicare for their entire practice, and they could charge up to 15% extra. They're called Part B excess charges. These are very rare. They found that just about 1% of all health claims they even charge these, and even then it was less than $20. However, there's a good chance your doctor accepts the assigned rates from Medicare. You can either visit Medicare.gov or just ask your doctor, do you take assignment from Medicare? There's 99% chance they do, and you won't even run into one of these, and therefore you won't have to pay any excess charges. Plan G pays those for you. Again, much higher premium. Plan N, very rare. Probably you'd never even see an excess charge. Now, the following states listed beside me do not even charge Part B excess charges. They're not allowed to. So if you're in one of those states especially, we should look at Plan N because it's going to be a great option for you. To make it easy, here's a real-life example of how Plan N works when you use your coverage. This is Judy. She's our newest client. She had called in after seeing one of our videos, and she realized how much money she could save by switching from Plan G down to Plan N. Well, let's assume she needs to go use her coverage and it's the first of the year. Judy visits the doctor and she will then get billed the Medicare Part B deductible. Again, this is a once per year charge you have to pay prior to Medicare paying 80% of your medical bills. So in 2021, this deductible is $203. This will go up slightly in 2022, but it works the same. So let's assume it's 2021. Judy does, in fact, pay the $203 Part B deductible, and then Medicare begins paying 80% of her bills, and her Medicare Plan N will pay the remaining 20%. But for example's sake, let's say Judy needs to go back to the doctor again during the calendar year. Well, she will be billed a $20 copay. Now again, this copay is just dependent, the amount, on what she goes for and how they code the visit. It could be $0 or it could be somewhere in between, but never more than $20. In this case, Judy gets the $20 copay bill in the mail and she pays it. Had she done a telehealth visit, she would have no copay. So it just depends. If you need to go see your doctor, you know that the copay will never be more than $20 if you have a Plan N. Now, a few months go by and Judy has to go to the emergency room for something. They find out she's okay, she's going to go home, she's not admitted. They will bill her a $50 copay. Now, had it been something that Judy thought she could go to the urgent care center for, well, then there would be no copay. Now, one other thing is Judy goes to the doctor, she has to ask them, do you take Medicare assignment? She's got a 99% chance that her doctor does, in fact, so she will not have to pay any Medicare Part B excess charges. In the event her doctor didn't, that very rare event, she would have to pay up to 15% extra of what Medicare would pay the doctor. Again, 99% of the doctors out there do not charge excess charges, so this is likely something Judy would not even have to worry about. So let's talk about the cost of Plan N again, up to $25 or $30 less per month than Plan G. That's why we have moved so many people more than ever before from a Plan G to a Plan N. But those lower rate increases are really what comes into play. Now, we check the rates for our clients every single year because of rate increases. On a Medicare Plan N, boy, we're almost moving nobody because they have those nice low rate increases. So you start at a lower premium and have lower rate increases. Again, if you don't visit your doctor very often, there's no reason why we shouldn't look at Plan N for you. However, if you visit often, say once a month or more, as I mentioned, maybe Plan G is a little better for you. Either way, we can help you decide. And the easiest way is just to give us a call now at 1-888-891-0229. And one of us will help walk you through the entire process, answer all of your questions, and make sure you get on the best plan for the lowest premium. And we'll do that every year for you. So thanks again for watching. We look forward to talking with you soon.